in this video, we're going to discuss experiments. So we have several terms that we need to go over just so that we can understand what we're talking about later in this video and in future videos related to this topic. So an experiment is a study in which the effects of a treatment are measured. So in an experiment, you're putting in some kind of intervention or treatment, and then you're measuring how effective that was. Confounding is really important to keep in mind. So a confounding variable is one that could impact your study because it may be actually causing the outcome, but you weren't measuring the effects of that variable. So two or more potential variables that could have caused the outcome, it's not possible to determine which actually caused the result. So an example, a drug company completed a study to determine if a new weight loss pill caused participants to lose weight. The participants lost an average of 10 pounds in 8 weeks. However, all participants were also required to diet and exercise for those 8 weeks. In this case, you cannot be sure that the weight loss is a result of the diet pill rather than the diet and the exercise, or some combination of the two. So you have to keep that in mind if you're going to perform some kind of an experiment. And you also want to keep that in mind when you're hearing information given to you from some study. This you can actually see when you look at the commercials for possible weight loss drugs. A lot of times in small print on the screen, it will say participants were asked to diet and exercise. And so if that's the case, you don't know if the weight loss pill is actually causing the weight loss, or if the change in the people's diet and or exercise is what's causing them to lose weight. So that's an example of confounding variables. A control group is used to contrast with the experimental group. So a company might test something, like in this example, they test a new plant food to grow 2 crops of plants. They plant them in adjacent fields. The treatment group receives the new plant food, and the control group does not receive the new plant food. Then the crop yield would be compared. By growing them at the same time in adjacent fields, they are controlling for weather and other confounding factors. So they're setting their experiment up so that they're planting it at the same time using adjacent fields so that weather is not a factor, type of soil wouldn't really be a factor, because they're kind of trying to control for that. So by giving one group the new plant food, that group would be the treatment group, and the other group does not get the plant food, so that would be the control group, and then they'll compare them and see which field yields the better crop. So a placebo effect is when the effectiveness of a treatment is influenced by the patient's perception of how effective they think the treatment will be. So a result might be seen even if the treatment is actually ineffectual. So an example would be, and this is a true study, a study found that when doing painful dental tooth extractions, patients told they were receiving a strong painkiller while actually receiving a saltwater injection found as much pain relief as patients receiving a dose of morphine. That's pretty amazing. So just because they thought that they were getting morphine, they felt some pain relief. Not just some, as much pain relief as people actually receiving morphine. So that is the placebo effect. A placebo is a dummy treatment given to control for the placebo effect. So an experiment that gives the control group a placebo is called a placebo-controlled experiment. So in the crops, you have 2 fields of corn. One field is not going to know whether it's getting plant food or not. But if you're doing an experiment with drugs, you often want to control for the placebo effect by giving a dummy treatment, maybe a saline solution, a sugar pill, something like that, to control for that. So in a study on the effect of alcohol on memory, a non-alcoholic beer might be given to the control group as a placebo. So maybe you would do some kind of field sobriety tests and see how many beers would potentially impact the results. And so for some, you could give them a beer, in air quotes, a beer, even though it's non-alcoholic, and then see if the person thinking that they've had a beer or two or three, how that will impact their ability to pass the field sobriety test. A blind study is one in which the participant does not know whether or not they are receiving the treatment or a placebo. So they, for example, in a drug trial, they might go in and they get a shot and they don't know if that shot is, let's say, a new vaccine for COVID or a saline solution. They don't know what they got. A double-blind study is one in which neither the participants nor those interacting with the participants, like a doctor, know who is in the treatment group and who is in the control group. So an example is in a study about antidepressant medicine, you would not want the psychological evaluator to know whether the patient is in the treatment or control group, as it might influence their evaluation. So the experiment should be conducted as a double-blind study. Okay, with all that being said, let's look at this scenario. So a researcher is trying to determine the effectiveness of his new anti-anxiety medication. He randomly divides the participants into two groups. Group 1 receives the new anti-anxiety medication in a pill each day. Group 2 receives a sugar pill. Neither the patients nor the psychiatrists examining the participants know which group they were in. So part A, which group is the treatment group? So the treatment group is group 1. They're the ones that are actually receiving the treatment, which is the new anti-anxiety medication. Which group is the control group? That would be group 2. They're the ones that are actually receiving just a sugar pill, so they are the control group. Does one of the groups receive a placebo? If so, which group? So yes, group 2. Because group 2 is receiving a sugar pill. So they don't know if it's a sugar pill or the actual pill. And so they're trying to control for any mental effects that maybe they just feel like they're getting better because they think they're being treated, when in actuality they're just receiving a placebo. Is this study a blind study, double-blind study, or neither? So in the last statement, it says neither the patients nor the psychiatrists know which group they were in. So that would be a double-blind study.